Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome to Bad to the Bones podcast. On today's episode, Dr. Mostello joins us to discuss current trends in the treatment of rotator cuff tears. Dr. Mostello is an orthopedic surgeon, fellowship trained in arthroscopy and sports medicine. His practice focuses on musculoskeletal conditions affecting the shoulder, elbow, and knee. Dr. Mostello treats patients across all ages and abilities, from young athletes to weekend warriors and active seniors. Dr. Mostello, we are excited to have you back today to talk about one of the most popular injuries you probably see with your patients, right? The rotator cuff.
Absolutely. Thanks for having me back.
You're welcome. I'm going to love this conversation because I think a lot of our listeners are really going to get a good understanding of how our rotator cuff plays a role in everyday activities. But before we dive into it, can you explain a little bit about the subspecialty of arthroscopy and sports medicine?
Yes, so the subspecialty of arthroscopy and sports medicine really focuses on the treatment of conditions that affect muscle, tendons, ligaments, and cartilage of the joints of the body. The shoulder, knee, and elbow wind up being the most common joints treated, though some sports medicine surgeons will treat conditions of the hip as well as the ankle. I think sports medicine can be a little bit misleading at times, and people might think that we only treat young patients or athletes, but really many of the problems that occur in the knee, shoulder, and elbow affect patients at all stages of life. So our practices and the ages of patients we treat wind up being quite broad. Now, the arthroscopy side of things, arthroscopic surgery is the use of small incisions to insert a camera as well as small instruments through portals that we create with these incisions. And the advent of this allowed us to avoid some of the larger incisions that were associated with the procedures that we do. Not all procedures can be done this way, but many of the common ones can, or there's an arthroscopic component to it. And because sports medicine surgeons are treating a lot of the conditions that you can perform arthroscopic surgery for, they wind up being very well versed in arthroscopy itself.
And I'm assuming with that smaller incision, the healing time is less. Would that be accurate?
It can be in the short term, but I would, full disclosure, a lot of times the longer term outcomes aren't significantly affected by it, rotator cuff being one of them. But it does make a difference with things like ACL surgery that normally had to be done through an open incision. So we're seeing differences with that long term.
Okay. Well, let's get into what I'm excited to have a better understanding about is let's talk about the structure of the shoulder and what exactly the rotator cuff is responsible for helping us perform.
Of course. So the shoulder joint itself is akin to a ball and socket, but a lot of shoulder surgeons will refer to it and use the analogy of a golf ball on a tee. You have a large ball, which is the humeral head, that articulates with a very flat and small socket, which is called the glenoid. And with that, a lot of the stability of the shoulder joint does not come from the bones themselves, but through the tendons, muscles, and ligaments that cross the joint. So this is in contrast to the hip, which is a true ball and socket joint with a lot of bony stability. So you lose some function with the shoulder joint when you have tears of the tendons or ligaments that cross it. The rotator cuff itself is a group of 4 tendons, which you can see in this model here.
For those of us, our listeners who are watching the video portion, Dr. Mostello is demonstrating on a model, so this will be good.
So these tendons, they have names: supraspinatus, infraspinatus, teres minor, and subscapularis. And that's more for us to know, but it's important for patients to realize that there are 4 tendons. It's not just one tendon.
Yeah.
And what the rotator cuff primarily serves in terms of function, it's a joint stabilizer. So it allows the bigger muscle groups of the body, like the deltoid, the pec, and the lats, to lever off of it so they can raise the arm. So when you have a tear of the rotator cuff, it can cause pain, but as you get into bigger tears, you start getting weakness in the shoulder.
So what are some of the daily functions that we perform where the rotator cuff is involved?
So I would say almost everything you do with your shoulder involves the rotator cuff pretty much, because any movement of the shoulder, you're going to have, subconsciously your body activating your rotator cuff to stabilize the humeral head and allow the bigger muscles to move your shoulder. So patients with tears will tell you. Yeah.
Yeah, it's a pretty important function of our body to have that moving smoothly. And what are some of when a patient comes in with pain in the shoulder and it is a rotator cuff tear, are you seeing it's from aging, overuse? Clearly if it's from a sports injury, it's from a sports injury, but for your everyday patients, what are you seeing?
I'd say most rotator cuff tears in general are going to be overuse injuries and occur over time. There's a percentage that can be traumatic, but most are what we call degenerative tears. And that is in part due, again, to the blood supply of that part of the tendon where it does not have a good blood supply. So microscopic tears wind up growing over time because the body lacks the capacity to heal it. And eventually it turns into a macroscopic tear that gets bigger as time goes on.
So as we're aging and we have less blood supply to specific areas of our body, that's why it would be more likely to tear it as you age?
Yeah, it happens just from using it.
Wow.
If any patients are listening, I make another analogy a lot. It's tires on a car.
Yeah.
Driving your car, normally they're still going to wear down because it can't regenerate itself. And that's what we see with certain conditions of the body.
Interesting. And so how do you diagnose a rotator cuff tear?
So a lot of times we have an idea of whether or not someone has a rotator cuff tear just based on the history and our clinical examination alone. Again, diagnostic test-wise, MRI is very common to order for confirming our suspicions of a rotator cuff tear. It also gives us a better idea of the size of the tear and other characteristics such as retraction or atrophy of the muscles, which will influence treatment.
And does that treatment, I would assume from the MRI, you would decide whether you can try non-surgical treatments or it's non-surgical treatment's not going to work and you need to have surgery. How's that decided?
Yeah, so typically, as long as I'm not suspecting a very large tear, which can be evident by a lot of weakness in the shoulder, we're trying some sort of non-surgical treatment first, similar to the knee, where physical therapy, injections, and that can be effective for people. And if it resolves their symptoms, then I say don't do anything else. Because doing anything, especially surgery, is a good way to get a problem if you don't have one.
Right.
But if the pain returns after non-surgical treatment and we get an MRI, depending on the size of the tear, again, if it's just something like tendinitis, then I frequently will, advocate for continued non-operative treatment. As you get into higher grade, what we call higher grade partial tears or full thickness tears, I'll discuss surgery with patients.
Is this what it would be? So when someone is going to have surgery, is that take them out of the game for everything? I mean, are they like down for the count for a good amount of time? How long is the recovery of that?
This is what I think affects people the most. And if they've talked to someone who had rotator cuff surgery, there are definitely horror stories out there about the recovery, because the rehabilitation for a repair is long. It's often months of rehabilitation. And that's because the process has to start slow to allow the tendon to heal. So patients aren't really doing that much. They're in a sling. They can't move their arm. And people don't realize how much not having an arm affects their life. I mean, even things like driving. If you're in a sling, you can't really drive. Now, for smaller tears, I usually start physical therapy around 2 weeks. But for larger tears, I start therapy sometimes 4 or 6 weeks after, trading some stiffness in the shoulder for healing of the repair. And then the strengthening and conditioning takes the longest, and that's the reason why I say small tears, sometimes 3 to 6 months. Everyone's a little bit different, but larger tears, I'll say 6 months to a year of recovery, but that's how you define it, where you're not completely debilitated for that amount of time. But before you're starting to see surgery make a difference, it might be that long. If someone's early and they get better quicker, no one looks back and said, you said this and I'm
Yeah.
late, and I'm early. But if you don't give people the appropriate amount of time that they need to consider where they might be affected by it, it can really impact their lives. So I try and give them, the averages.
A question actually that just came to my mind is, you talked about the lack of blood flow as we're aging. So when you do repair a rotator cuff tear, are you putting any sort of prosthetic type of thing in there, or you're just sewing things back together? And how would blood flow increase?
So the surgery itself usually involves creating a little bit of bleeding in the bone and on the tendon. But what we are seeing is the use of certain augments for rotator cuff repair, whether it be tissue grafts and recently small little kind of slices of bone to try and make the chances of healing a tear increase, because not every repair is successful, and we do see re-tears. At this point, the devices we use to repair the rotator cuff are now stronger than the tendon, so a lot of failures are poor quality tendon tearing through the sutures.
Yeah.
So we're looking at, again, biology as a means to improve our success rate.
So if someone is an avid athlete, they're a tennis player, a golfer, and they have a rotator cuff tear and they have to have surgery, what is the likelihood of them getting back to that sport?
I think overall pretty high, though I would say in elite overhead throwing athletes, usually any sort of rotator cuff surgery might be delayed until they're done being a competitive thrower. But recreationally throwing, golfing, tennis, the outcomes after rotator cuff surgery are very good. There's a high percentage of people who feel improved after it.
And what are some of the symptoms that someone, our listeners out there could be thinking, maybe I just pulled a muscle? What are the symptoms we'd be looking out for?
Again, not very specific, but pain that's directed to the outside of the shoulder, the lateral aspect of the shoulder. Because of the way the sensory nerves run in the shoulder, most commonly rotator cuff pain is on the outside of the shoulder. Another concerning sign is oftentimes weakness, trouble lifting things, particularly if your arm is straight.
Yeah.
In throwers, if they do have, and more commonly in throwers, it's a partial tear and a specific type of partial tear. But sometimes they'll know, pain or a key common phrase is loss of command, though that, again, in throwers, the biceps and where it attaches is probably more likely to be the cause than a rotator cuff tear.
Is there some new treatments and innovative procedures that you're pretty excited about for the rotator cuff tears?
Yeah, I alluded to it before, but again, there's a lot of interest in using biology to improve the quality of the tendon, sometimes on the molecular level rather than just sort of the structural level. But there are different tissue grafts that you can use to augment repairs, and we're looking into some types of injections. Some patients may have heard of it, like PRP or platelet-rich plasma. The data is still coming in, so there's no consensus yet. But I'm seeing an increased use and a lot of increased discussion on using biologics as a means to address, rotator cuff pathology. That's
exciting. That's very exciting. Have you seen some success with patients being able to get back to their daily functions with just physical therapy?
Yeah, that's definitely an option for people, and it's a function of what your activities of daily living are, and whether or not it affects you. But physical therapy is a valid form of treatment for rotator cuff tears at any stage, really. It's an option for people. I don't want them to think that their only option is surgery. Sometimes, the benefits of surgery are high, and it's worth considering doing it. But inevitably, whether it's before surgery or after surgery, physical therapy can be beneficial and typically focuses on strengthening the other muscles around the shoulder.
So that leads into my next question. I was going to ask you, are there maybe 2 or 3 tips that you could give our listeners that maybe they could do exercise-wise to prevent that type of injury for a rotator cuff?
Yeah, I think, again, exercises like rows or exercises that focus on the scapular muscles are really beneficial to patients, and that is what they will see when they do formal physical therapy. proper throwing mechanics, I think, for athletes is good for any sort of injury that they might have, not just rotator cuff tears. And believe it or not, that actually starts sort of with the trunk and core muscles, because that weakness in that area and deconditioning in that area is usually what starts the cascade of poor throwing mechanics and where you see a lot of elbow problems and shoulder problems.
Interesting. So if you have a rotator cuff tear, does it seem to affect the shoulder? I mean, the elbow as well?
Not so much the elbow directly, although patients might have pain that radiates down to the elbow. But you can have other elbow conditions as a thrower that result from compensating for shoulder pain. And then more commonly, I'd say in non-throwers is patients will have pain that radiates up their neck. So they wind up using their trapezius to shrug their shoulder because they don't want to move their shoulder itself. So I see a lot of compensatory strains of that muscle as a result of shoulder pain in general, but rotator cuff tears being one of them.
Very good information. Thank you, Dr. Mostello, for discussing the diagnosis, treatment options, and prevention of rotator cuff tears. I think our listeners have some great takeaways from this episode, and we're thankful that you shared your perspective and your passion. If you or someone you know experiences shoulder pain or has experienced, some type of injury to the shoulder, I think it's important for you to give us a call today at 856-690-1616, or you can go online and schedule an appointment at poasnj.com. We have 12 locations across southern New Jersey in Gloucester, Camden, Atlantic, Salem, and Cumberland counties, so we are here to serve you. Our newest location is located on Almanesson Road in Deptford, where the Dick's Sporting Goods. It was the old Dick's Sporting Goods across from the mall, if you're familiar with that. So we hope to see you at one of our locations. Join us on our next episode. And until then, we hope you get out there and stay active and healthy. Have a great day.